Good morning.
Good morning.
Good morning.
How's
Good morning.
everyone? Nice and bright today.
Yeah. Peachy.
Peachy.
Yeah.
Well,
Feeling a
welcome,
little chilly.
guys. Huh?
A little chilly this morning.
A little chilly. So, welcome to the table talk. Today we have George. I think you froze. Oh, there you go. Jason.
Good morning.
Art's on the ones and twos, and me, Marissa, with PEI. Today we're going to be talking about mental health stats and what those mean. Today we're going to have an awesome guest speaker with us, Pedro Domingo. Without further ado, thank you for your presence, Pedro. And would you want to tell us a little bit about yourself and your program?
Sure. Well, everyone, my name is Pedro. I am part of the Research and Student Development Department here at Indian Health Council, which is relatively new. If you've listened up to the What About Life podcast last week and this week, you could learn a little bit more about what we do. But personally, I coordinate a grant here that is looking to reduce and prevent underage drinking and other substance use through different types of intervention that work together to have an impact not only on youth themselves, but hopefully the community as well. And yeah, that's just a brief background in terms of the work that I do.
Nice. Thank you for that. And if you guys caught any of our What About Life podcasts, you'll hear us discussing about mental health statistics and resources. And as you may know, we do a lot of outreach. And we're always, hey, can you fill out a survey for us? Can you do a survey? We have some incentives if you would, to entice you to do those more. And what we want to do here is to kind of explain why we do those surveys. What are we pulling from those surveys? So Pedro's here to kind of clarify that, get some in-depth information and some, reasons why we do these surveys and what those numbers mean to us as far as, getting our programs funded and what we can do better in the community. So, it all ties in together. So take it away, Pedro.
Oh, okay. Well,
Yeah.
I think something that we could briefly go over in terms of what we were talking about during the What About Life podcast is like what the broad overall reason for having surveys done locally, and I'll talk from personal experience, although again, I will refer people back to the talk to see how the PI, the team themselves kind of uses that information. But talking about my project in specific, thank you for having me on. This is actually a really good chance to let everyone know exactly how one of our projects at least does research. But with my project, we're doing an intervention with youth that was formatted as group sessions, talking about the dangers, consequences, the youth's reasons to either abstain from using or reduce or not use more in the future if they were using. And that was, again, through a group intervention, that was a group discussion. We were using things like psychoeducation, which was really like the standard of what a lot of counseling people do with substance abuse counseling. And then we were also using motivational interviewing, which is looking more at the individual's perspective and wants, needs, reasons to not use or reduce using. And with that, we collected data through surveys before they went through the intervention just to see where they're at. Some kids were using, some kids weren't. But the importance of that is seeing, again, after the intervention, we did a follow-up with them using the same survey 6 months afterward to see if there was a difference in their answers after going through the intervention. So before they went through the intervention, they could have been at some place, and then 6 months after the intervention, we wanted to see if in some regards did they start using less alcohol, less types of substances like marijuana, vaping, And in other cases, if they weren't using it to begin with, did they continue to abstain from using? So that was at least it is more of a over a time, although in comparison to a lot of studies, it wasn't like a grand time frame of like years per se. But at least that could give us some insight in terms of whether those interventions are useful in like a 6 month time span. Originally, we were looking at doing more interventions, although it is difficult given that with the age groups that we're working with, they're really busy. And it was more doable doing like one long intervention that was about an hour with a group of youth instead. And again, part of that was to see if these interventions work by collecting data. And at the same time, we're also not just collecting data from youth who were part of the intervention, but we're also going out into the community, collecting the same type of information from kids who weren't part of the intervention. That way, as we're coming to a close now, we can to get this data and see what results we find. We can look at youth who were part of the intervention, and then we can look at how do they compare or contrast to youth who weren't part of the intervention? And hopefully, our hypothesis or what we are our educated guess in terms of what we're supposed to see is that kids who went through the intervention fared better in terms of whether they reduced use if they were using or continued to abstain if they weren't using as compared to kids who didn't go through the intervention. And those are some ways that at least the surveys help us in collecting that data. And in the future, overall, seeing the results for that, if we do find the results that are meaningful, it can really help apply or it can really help us establish the reasons for continuing to provide services like that service that was, again, having group discussion with kids. So that's overall like one example, at least specifically for my project in terms of how we used surveys and data.
This month, Jason and myself, our outreach topic is really covering mental health statistics in general and generalizing the statistics specifically as they relate to mental health. And the goal is that we kind of read those statistics and share them and then reflect on them and say, okay, where do we stand in being a statistic, and where do we go from here, and how can we make it positive? I look at it kind of like a lot of athletes use statistics to like get better and improve in like their sport. Let's say basketball shooters are looking at their shooting percentage and how many free throws they made. And the goal with Jason and myself sharing the information is that we can look at these statistics. Some of the statistics we could talk about if you guys want, but and say, okay, this is what my community is showing. This is where I stand with it, or outside of it, and how do we go? Where do we go from here? I guess part of it would be, do we need to address an issue, or are we doing okay? So there's a lot that go with all these statistics. And I think from our standpoint, as professionals, we doing the research as a research person, and then as the youth or the parent or whoever it is that we're surveying or gathering statistics from, all have a different perspective. So I think it's cool that we're using those, that you shared those with us. There's some pretty extensive surveys that you shared with us, like the California Healthy Kid Survey. There's some pretty interesting statistics there.
Yes, there really is. And again, reflecting on what you had just mentioned in terms of like, can we look at where our status is? That's the really nice thing about using local data, at least in terms of when it comes to, sorry, someone came in for a second. The really nice and important thing is if I'm collecting data locally from kids, that that data will be specific to the kids in our community and really give us a good snapshot in terms of where we're at, as you mentioned, or if we need to do more. Hence why we have interventions in the first place to prevent, reduce underage drinking and other substance use. But going back to the California Healthy Kids Survey, with that one specifically, it is a survey that's administered by school districts or specific schools. It's elective, meaning that it's voluntary. The schools don't have to administer it unless they have like grant requirements that require them to give specific parts of that survey to their kids, which we were able to do this year with one of our local school districts. And it's nice that in the upcoming year, we'll have updated data that tells us a little bit more about where our kids locally in our nearby school district stand at. But what George was referring to in terms of the data that we have seen, the more recent one was from the years of 2017 to 2019. It does get updated every 3 to 4 years just because it's looking at it every 2 to 3 years, 2017, 2018, 2019. And again, that data is collected in schools, usually grades 7th, 9th, and 11th, just to get a snapshot of these different age ranges. And I believe when we're talking about during the podcast last week, we saw how a really important statistic that popped out to us was that we'd see youth, specifically Native youth in California, at least 1 in 4 had reported experiencing chronic sadness or hopelessness. And that is important in terms of like when we think about it as compared to other races and ethnicities, it was pretty high in comparison, meaning like what are the specific things that might be experienced by Native youth that cause them to report that they are feeling chronic sadness or hopelessness. And by administering surveys like the California Healthy Kids surveys, we can at the beginning or at some point now establish where we're at and try to figure out if we can do something about it. And if we are going to do something about it, what is that going to be? And that can also require collecting more data, whether it be in the form of the survey or potentially having interviews with the kids. So, yeah. And I believe we have a question.
How closely does IHC work with the local schools? Do you work with all res schools in the consortium tribes?
That's a really great question, and I'll probably leave that off to the PEI team since you all have been doing work here a lot longer than I have. But for me, at least specifically from the 4 years that I've been here, we've been able to do work with Julian High School, some work with Warner Unified School District, as well as some work with Valley Center's Continuation School and High School. And I guess some elementary school.
So for PEI pre-COVID, we were able to go out to the local schools and give some of these statistics and information on our topics, on our monthly topics. And since we went through COVID, now we are now being able to establish back in the schools and get back out there. So we are working with the schools to get back in there as we speak. There are a couple that we are going to be attending soon. There's a lot of stuff coming up in May and June. There's going to be a lot of graduations and stuff. So we're going to have to try to work with them through that as well.
And if someone's interested in getting their schools on our outreach list for, the summer programs, we're able to, try and work with you guys on getting those set up. So definitely hit us up at peindianhealth.com or one of us can assist.
If I may go back to what Pedro was talking about with gathering the statistics and identifying some of the issues, like you mentioned, the chronic sadness or hopelessness. I think what's important is that, especially coming from a community where or a situation where it's hard to ask for help, or there's not a lot of resources, identifying exactly what the issue may be. For example, in this situation, a kid is sad or hopeless, which you then start thinking, suicide ideas and things like that. It really helps us narrow down how to get this, what's going on with our child or what's going on with the individual, and then what help to get. Because a lot of times, talking about youth, like in this survey, we talked about, 7th, 9th, 11th graders. We could all agree that, we all have a difficult time with that age. We've all had a difficult time. And if we're raising kids at that age, it can be really difficult. So rather than saying, oh, that kid's got an attitude, which they probably do, but they also probably have something else going on. Matter of fact, 1 out of 4, and that's a lot. If we look at it as a school, maybe, there's 100 kids that are having a difficult time. So we could then say, okay, we need to deal with sadness, or we need, there's depression issues at the school, and why. And you can get all the way down to like what foods are being served in the cafeteria. I know that's kind of getting outside the box a little bit, but it helps you narrow down, like kind of like taking a car into a mechanic shop. So I think the surveys are important, identifying them and interpreting them is crucial.
Yeah, and I'd say, as you mentioned, you do a good comparison, or like analogy, in terms of why to have it. It is really, they really do serve as a starting point, especially if it's something that we haven't really looked into. I'll say even more so, and important is, once you get that data, let's say it is for this, how many kids are experiencing chronic sadness and hopelessness. It's good not to jump into assumptions in terms of like what we think the reasons are, although we'll probably have some really good reasons that make sense, have good rationale, may have truth to it. We could still use data and science to get more out of look more into that question that was asked, or that experience that kids are having. So let's say we do have, as mentioned, at least 1 in 4 kids saying that they've experienced chronic sadness or hopelessness over the past year. Now that we have that starting point, we now can potentially come up with questions that can look into that more, in terms of like, now we can be more specific, like what are some things that contribute to you using that, or contribute to you responding that you've experienced this chronic sadness and hopelessness. We can look at more specific, is it things, especially with our Native youth, is it things like discrimination? If we're looking at race and ethnicity, or if we're going to be looking at across the different grades, looking at questions, is it because there's like, what stressors are you facing as you're growing up that are making you report higher rates of a chronic sadness and hopelessness? So yes, kind of just to reiterate what George said, it really does serve as a starting point where we can then now look into it more and hopefully get answers or a better idea by engaging with like the population that we have. So hopefully if we do want to now do something about it, it'd be great to have those kids involved in terms of like, okay, what would help you feel better, and kind of help address this chronic sadness and hopelessness that you're experiencing.
And also, they're not alone. It's refreshing to know that you're not the only person dealing with this. This is something that we have going on. So I think that could be helpful as well.
Yeah, also, like when George was sharing, when we went to one of the schools, the kids were so engaged on some of the statistics that we were talking about, and they were kind of right on the percentages. They were maybe just a couple numbers off, but they recognized it as well. But sharing it with them, they were just so engaged and so interested in different things that we were talking about.
Yeah,
And
one of the big reasons that the last presentation we did, kids were talking about like how difficult social media can be. You know, we talked about sadness and hopelessness, and it was surprising because they love social media, and then you think about how much time we spend on it, and our kids as well, and all of them. It was almost like across the whole room was talking about cyberbullying, social media pressure, being picked on social media, and it was like, geez, that must be really difficult. And what's hard about it is we us older adults, this is new to us as well. So these kids going through it in school, it's hard for us to identify because we didn't have the same situation to turn back and relate to and give advice on. So it's interesting as we see it.
Exactly, and that's super good that you bring that up, because like that tells us that are we in the right position, like now that we have this data to make assumptions in terms of like, okay, what solutions do we have for the kids? And it wouldn't be realistic or in some ways like ethical because we haven't experienced it, something that we don't understand because we never experienced it, which is why it's important to loop in kids into the solutions that they want to see for the problems that they're facing.
But I think it gives us as educators a place to come in and say, we know that there's an issue. It's not me saying, well, I know that these kids over here are having problems. My kids have problems, so that means every kid has problems. That's not where we're coming from. We strive to, be evidence-based and to have references and be professional and do our research. So when we come in with a situation, it's because the numbers are showing this. So we want to have a conversation about it, and then hopefully connect them, to the resources.
Yes, exactly. And I mean, that also comes at a certain stage. Like, you're not going to immediately hop onto like, okay, we know it's social media.
Yeah.
Which is, again, I really like that we're talking about is because we could see that we could have come up to that point after collecting data that told us that where the kids told us that they were feeling sad and hopelessness. And then once we investigate it more deeply, then we see that it's social media that's contributing to it. And then we can even go deeper by looking at some of the examples that you listed, George. What exactly is it about social media? And they'll give us answers like cyberbullying. Maybe it might be comparisons. And then from that, again, we could, like in the healthcare field or in a lot of work, really, you want your efforts to be data driven. That way you have like a reason to back up, like why are we doing the things that we're doing? And again, more importantly, I think is once we know that, it's also using data from the population that we're helping or supporting to tell us what can we be doing. So not just like where we're at, but where can we go from here?
Absolutely.
Yeah. So there's a lot of research and statistics and surveys that we use. I know we focus mainly on mental health. So this month we've talked a lot about those statistics, but a lot of it does tie into substance abuse. So we are focusing. We brought our substance abuse counselor out with us a few times. We're hoping. I think we got Tina locked in for our next table talk, and she's our substance abuse counselor. And again, back to what Pedro was saying, we're not trying to put the cart before the horse, so to speak, and saying that we know there's hopelessness and we know drugs and alcohol are causing it, but we have an idea through some of the data that's been collected along the years, and also we would like to share a resource as well. And this may be what you need, and it may not be what you need, but just know that there is a resource available. because out here some of those resources are few and far between. You know, but the statistics that we see coming in, I think one of them I could check. One of them on substance abuse. What is it? 30% of kids have tried drugs and alcohol in the last month, I believe. Um, Let me get it so I'm not
50.
informing.
It's 50,
Let's see. More
right?
than let's see what we have here. Oh, here it is. I'm looking at the one from the California Healthy Kids.
Okay.
The in 2017 through 19, 30% of youth use drugs and alcohol one or more days in the past 30 days. One or more in the past 30 days. That's a lot.
And that's ages 12 to 17.
That's a lot.
Mm-hmm.
Yeah, that's almost 1 in 3.
Yeah, and that's local. So, but it's not my kids. It's not my kids.
And that's a good point that you bring up.
Just kidding.
Like in terms of like that survey specifically, is the responses are collected anonymously from kids, so that way it gives kids the chance to feel more honest or give more honest answers, knowing that their names won't be tied to it. Which is an important thing to like for parents and caregivers when those opportunities do arise. Why it's important to have kids participate, so we can really get a more accurate snapshot through their honest answers, and encouraging them like, oh yeah, just be honest when those opportunities do rise. I do want to mention something too, given catered to the question that we had earlier. In terms of the work that we do with the local schools, a lot of it also varies with how involved the schools want to be with us. A lot of the times, or actually I'll say like 50-50, it's either one of us or the other reaching out to kind of do something together related to whatever work we're doing. But parents and caregivers, especially if you have children at these schools, your voices are also important, which is why it's really good that if you want to see people from the clinic or us as staff from the clinic, like reach out to the people at the school that would be able to connect with them and make those decisions. Let them know that it's important, that you want the school to be partnering up with community organizations, people who are local, who your kids recognize, who they may be more trusting of, because we can only do so much as well. But if the schools see an interest from the community, and more specifically like the parents, caregivers of the children that they serve, there's more of a reason for schools wanting to be more actively engaged with us. So again, yes, like we do what we can, and we also ask that as, again, parents, caregivers who have a stake through their kids for the school, like always put your voice out there too, and let them know, what do you want to see with the school when it comes to working with us.
Well said, Pedro. And moving forward, we definitely want to offer resources. So, we can create a path to wellness. So we definitely have IHC is always as a good option. That number is 760-749-1410. Option 4 for behavioral health. We have the, NAMI San Diego hotline, 619-543-1434. And, a good resource we always like to promote is the 211 San Diego crisis line. And you can also, Google these numbers, resources all on the phone. So definitely reach out and get some help. You are your best advocate.
Looks like we have another question. Yeah, Marissa.
Okay, this one says, I am interning as a school social worker with Warner Springs, and I'm definitely seeing a high number of depression and social anxiety among students. I'm very interested in collaboration with IHC with surrounding resources that I see the students need. Awesome.
Yeah, we actually attend Warner. We go out there. Principal McLeod is super supportive and welcoming of our services. Your staff is super welcoming and very hospitable when we attend. So we're trying. We go out there at least once a month. I know Annette Reed, our substance abuse counselor, is actually going to get started with some in depth services. So reach out to us. You can message us or reach out, and we could set up a date or time to come out there if there's something more specific, or if you want to jump into our presentation when we go out there. I think the next time we're going to be out there is May 4th. May 4th. So they would probably say May the 4th be with you.
Yeah, and then like again, like we've definitely partnered up for Warner Springs. So if you're interested, definitely let your supervisors know. Like they know our contact information. We've definitely done like presentations. I remember one time we did I forgot what it's called. We went to the multi-purpose room and had like the whole school out there and gave like a brief presentation. But personally, I've done things like presentations on vaping, general mental health, I believe, as well. And yeah, some of that has been with PI, so it's great that we also work together to give those services.
Well, definitely reach out and let us know. We are over time. As always, it's a pleasure having you, Pedro.
Yeah, very.
Yes, thank you, Pedro.
Thank you all for having me.
Yes. Well, stay tuned for next
That's
week.
Dr. Pedro right there. He's a master, huh?
PhD. So stay tuned for our next table
They're
talk.
lying. Please do not take that seriously.
All right. We'll see you guys.
All right,
Until
cool.
next
Thanks
table
again,
talk.
Pedro.
Thank you.
Thank you,
Thank you all.
Pedro.